Hello, my name's Gemma. I'm one of the nurses at Blood Cancer UK. We had a question around pets and the risk that they may pose to blood cancer patients. Now, this is a question that we would encourage you to talk to your treatment team about because it really depends on your immune system and the treatment that you're having. However, many people live with their pets during their treatment, particularly when they have chronic blood cancers. So some top tips are to keep hand washing regularly, and if there is any waste from your pets, to particularly hand wash after this, and alternatively you can ask someone else to get rid of the waste. Also to observe any scratches or bites that may come from your pets, because they may have a chance of developing into an infection if they're not monitored. So to keep a close eye on things and talk to your treatment team.
Hello, I'm Fiona, one of the support services nurses here at Blood Cancer UK. We were asked the question, how long does it take for the spleen to start to reduce once you start treatment for CML? This really depends and varies from person to person. It can take a few weeks to a few months. Your haematology team will keep a close eye on you. They will be monitoring your blood and also monitoring your spleen. When you see them, they'll do a physical examination, but it's really important that if you feel like your symptoms are getting worse from a swollen spleen, such as feeling bloated, you've got any pain or new discomfort there, it's really important to let your haematology team know. Thank you. Skin mottling is a symptom of ET and it can often be seen in the legs and in the feet. Treatment for ET can often help with this symptom, so it's really important to speak to your haematology team about this, especially if it's a new symptom or it's getting worse. Yes, you do, because follicular lymphoma can weaken your immune system and make you more susceptible to infection. Therefore, it's important to be careful and manage your risk. It's important to make sure that you're up to date with all your vaccinations, and if you're unsure, to discuss with your medical team.
Thank you for this really interesting question. I unfortunately do not have a lot of insight into sort of ongoing research for the preventative medication for AML. However, there are lots of clinical trials ongoing, and if you wanted to talk specifically about trials for ET or options for yourself, you'd be very welcome to refer into our clinical trials support service and have a chat with one of our specialist nurses. I'll pop a link to the referral form on the video, and if that's of interest to you, you're very welcome to refer in.
Chemotherapy itself doesn't cause stretch marks, although it can lead to many skin changes such as dry, itchy and sensitive skin. Steroids, which are an important part of many people's chemotherapy treatment regimes, may lead to stretch marks. Swollen lymph glands normally appear in your neck, under your armpits, your groin area or the collarbone, although occasionally they can appear in other areas of the body too. Swollen lymph glands are normally painless, although sometimes they can press on organs within the body, and this might cause pain, say, in the chest or the abdominal area. The immune system is not as compromised when you're on active monitoring compared to when you're on any form of treatment for blood cancer, such as chemotherapy, targeted therapies or radiotherapy.
It's not recommended to have treatment when you're unwell, as the chemotherapy could make your symptoms worse and make you more poorly. We would recommend that you reach out to your treatment team and let them know what's going on, let them know you're unwell, and they can make a plan for your treatment going forward. They'll also make recommendations for you while you're unwell at the moment to make sure you get better as quickly as possible. It is possible to take multivitamins alongside your treatment, but you do need to speak to your team about this. To do that, you can speak with your nurse specialist, your doctor, or you can even speak to the pharmacist where you collect your medication. They'll run some checks to check the medication you wish to take against the medication you're already taking, and just ensure that there's no possible interactions.
As you said in the question, this was due to a supply issue, which is unfortunate. What we would say is occasional missing doses is not going to affect the outcome of your treatment. Regularly missing doses every month, say, can affect the outcomes of the treatment. So on these occasions where there's a supply issue, or for instance you've been unwell, these are things that we understand can happen. If you've got any worries about your blood tests or your response to treatment, do always speak to your treatment team. We've had a question from someone with essential thrombocythemia, which is a type of blood cancer. They're not feeling too well today, and they also had an alert on their Fitbit to say they have a lower pulse rate. Now, whilst the pulse rate may not be accurate, I think because you've said you don't feel well and you've had this alert, it's really wise to speak to your treatment team. They will be best placed to assess you. And really, if you don't feel right, you should report symptoms to them. So wishing you better, and I'm sure your treatment team will reassure you.
Hi there, this is Heidi, just coming back on to talk about preparation and tips for autologous stem cell transplant. Firstly, I just wanted to say there should be ample opportunity to go through things with your treatment team. So if you have got questions or worries or concerns, please jot them down and take them in to go through with the team in advance. It is quite a journey to go through, so I would encourage you to be kind to yourself. Take one step at a time, one stage at a time, and don't put too much pressure on. Things to do in advance, I mean, just simple stuff like maybe good nutrition, some gentle exercise or fresh air. It doesn't matter how small those things are, they can have a big impact to the recovery process. So that would be really important. And otherwise, I think it's just ensuring you've got good support on as you go through, things to keep you busy, particularly if you're sort of isolating or a bit more restricted. So keeping your brain busy, and finally wishing you all the very best from us.
We got a question from the mum of a 33-year-old man who has had treatment for blood cancer, and they are worried that their son may relapse in the future, even though he's fine. It's totally understandable to be concerned about your loved ones, particularly when they've been through treatment for blood cancer. What we would say is listen to the fact that he is fine. I suspect he'll be followed up by the hospital team that looked after him, and they will look for any worries or concerns going forward. If you would like to speak to us about your concerns, we very much would encourage you to do so. Our number will be at the bottom of this post, and we very much want to support people affected by blood cancer and their loved ones.
Hello, it's Fiona again. So we were asked the question, can myeloma patients have children because of maintenance treatment? So the most common maintenance treatment for myeloma is lenalidomide maintenance, and this is normally given following on from high-dose chemotherapy and a stem cell transplant. You must not take lenalidomide if you are planning to become pregnant or are pregnant, because it is expected to be harmful to the unborn child. So you really need to speak to your haematology team about having children and planning a pregnancy, so they can support you and advise you in the safest and best possible way. I've also linked in our fertility pages here, which I hope you find helpful.
With regards to fatigue, this is a real significant symptom of blood cancer, and it's something that many people experience. So you're definitely not on your own. There are a handful of things that you can do to try to help, such as gentle exercise, fresh air, balanced diet. Generally, keeping active really helps. It might be helpful to keep a note or a fatigue diary of recent days to find what days have been worse than others. And this can help you find some sort of balance and find what works for you. Some people find that if they know they've got a particularly busy day one day, then having a rested day the next really helps to balance out the symptoms. I would encourage you to have a chat with your team if this is perhaps a new change or something that's worsening, as they may also be able to make some helpful suggestions.